Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, of late, more and more of FYI viewers wrote into us by this peculiar thing that has come up in midst of the second wave. This peculiar thing is that despite having all the symptoms of COVID, sometimes even the CT scan showing that you have patches in your lungs, you continue to test RT-PCR negative. 1, 2, 3, at times multiple RT-PCR tests said to be the gold standard for testing COVID-19 is still coming up with false negatives. Why is that happening? And if you are also one of those going through it or somebody in your family and friends going through it, what should you do? That is what we'll tell you in this explainer. Now, so far, reports that are coming to us from various doctors across the country is that at least 1 in 5 patients may end up getting a false negative report. Why is that happening? Why is the gold standard of COVID failing? FYI, reason number 1. The test so far suggests at this time that they have not really adapted to the new variants. In particular, the UK variant is showing some deletions. FYI, reason number 2, low viral load, meaning the viral load in your body is so less that it's not always cropping up in your RT-PCR testing. And then FYI, reason number 3, testing overload at this time is compromising on quality. Sample collection is being wrongly done. This has been seen in several cities. Remember, where we saw in one city a gardener was put on duty to collect the samples. Of course, the quality was compromised. These are 3 basic reasons that we've pulled out for you. But don't worry, what are you to do in case this happens? First up, number 1 thing to do is inform your doctor and share your symptoms. Next, you should keep a constant tab of your oxygen levels. Remember the little oximeter that is now available online everywhere in your nearest chemist store as well. Get that, keep it handy, and if it falls below 94, you should inform your doctor. It is a reason of concern. Then, next you should repeat your RT-PCR test in the next 2 to 3 days. And even then, if the symptoms persist, get a CT scan. But don't just start queuing up outside these centers in a rush to get a CT scan done. Take the advice of your doctor, only then go for a CT scan. And number 4, get a blood test. Blood tests at times are a good marker of inflammation, and they can also give you and your doctor an idea about what's going on in your body. In particular, the R-reactive protein and the D-dimer. Both of them said to be a good sort of testing ground of understanding what's happening in your body. So this is what you should be doing in case you are testing negative but still showing all symptoms of COVID. But why is that happening really? Let's try and dive into the details over here. And for that, we've got the best voices in the country for you. Dr Harsh Mahajan joins us now. He's the president and founder for chief radiologist at the Mahajan Imaging as well. Thank you so much for your time, sir. Dr. V. Ravi is with us. He's the head of department at Ninhans, and he's on the advisory board for Sputnik as well. We've got Dr. A. Vilumani, and he's the MD and CEO of ThyroCare. Extremely overburdened centers there are. We'll try and touch that upon as well. And we also have Dr. Sumit Ray with us to give us a perspective on more and more what are the things that are cropping up, because doctors at this point are getting the first feelers of what really is happening, because all of us know at this point that our genome sequencing is extremely poor in the country, and that is where the main challenge really lies, because if you don't know your enemy, how are you to fight it? Let me get the first word in from Dr. Mahajan here. Dr. Mahajan, from what I understand basically of RT-PCR testing, it tests on 3 genes, right? And more of late, we've got to know that the UK variant is sort of not reflecting in one of them. Is that true, or some more details can you share with us at this point?
Thank you very much, Sonal, and good evening. And I must compliment NDTV that you've done great research, and actually you've left very little for the experts to say. But having said that, Let me take it point by point. Point number one, right from day one, even though RT-PCR is a gold standard, we have known that there is 30% false negative results that we will get.
30%.
That was the case in March of last year. That's the case even today. Number two, for getting a negative result, we need to remember that the incubation period for getting the infection is very wide. It varies from 2 to 14 days. So you may get a negative test result, yes, at 4 days and get a positive at 6, 7, 8 days. The average that we know is about 5 days. So when there is exposure, we tell patients to come not on the first day, second day or third day, isolate themselves after exposure to someone who's positive. And the earliest they need to come is the 5th day or the 6th day. And then the chance of getting a positive result is high.
But Dr. Mahajan, isn't that a change from what we saw in 2020? Because in 2020, by third day or so, we thought that the test would show positive in case you had contracted the virus.
No, there's no change there. You know, it can be positive on the third day also, but more likely to be positive on the 5th or 6th day. Point number three, which you alluded to, is the collections, the way you are collecting. That matters. Then transportation, that matters. And when you're overburdened with cases and you are actually not able to complete the analysis within 24 hours, you have to store the sample. And we know now that we are going to 48 hours, in some states it's even going long, more than that, then you need to store it at minus 20 degrees centigrade. And if that has not been done, then again your chance of getting a negative becomes higher. Then let me get to the strains which you alluded to. Now, when these testing kits are made, you know, you pick up parts of the virus which are least prone to getting mutations. We do know the virus is going to mutate, but those are the areas that are picked up which are least prone to mutation. And really, if you see the genomic testing that has been done, the whole genome sequencing, that has been done only on samples which turned out to be positive on RT-PCR. That is how ICMR is doing the testing.
Right.
So we have not missed. Those came positive, and those were the ones that were sent for genome sequencing. And that's how we know what mutations happened, which are the strains, be it the UK strain, the so-called double mutant in Maharashtra, or the South African, Brazilian, or the garden variety, which is the Wuhan strain. Also, I must emphasize, at the present point of time, most kits that are used in India are able to cover for these strains. That's how they come out positive, and that's how, when ICMR does the whole genome sequencing, we find that there are mutations happening.
That seems to be the only good news that you've given us right now, that so far we are able to capture them. But more and more doctors saying that the UK variant extremely notorious, and even the double mutation over there. Let me bring in Dr. A. Velumini as well, the MD and CEO of ThyroCare over there. Doctor, can you tell us, are there two different kind of RT-PCR tests right now? And are there new primers which have been got in? Just for the benefit of our viewers, primers are basically what detects the RNA in the testing. So simply put, are our kits, the testing kits in the country, have they adapted? And are they efficient enough to pick on these new strains?
There are almost some 3-4 dozens of vendors available. And what kits are available have either 3 genes or 2 genes. Sometimes 2 genes appear to be more than enough, and very often, in a fear of missing out, we select to have which has 3 genes. I think if at all somebody who can talk which kits are good, which kits are bad, which covers, which doesn't, is only ICMR and NIV which will be able to do. Laboratories have to buy a brand and start working on it. So that not that laboratory level, we will know that which kit is better and which kit is not.
Got your point.
Coming back to the false negative, And Dr. Mahajan was telling 30%. I would say in my experience, it's around 5% to 7%.
Okay.
That is because the technicians are not adequately trained to collect the specimen, not at a laboratory technology level. It's almost always collection level. But I must tell you, in the last April, we did not have any experience of swab collection significantly. Today we have daily 1 million tests done. So we are having expertise of collection. So I don't see those are the big challenges. And as Dr. Mahajan said, only after we identifying NIV is sequencing, that means we have identified using the kits and sequencing is subsequently happening.
Right.
And the days it takes for showing positive is so subjective, very difficult to conclude that.
So Dr. Mahajan said about 5 days. What do you think?
I think anywhere from 3 days to 7-8 days it takes to show up. How do you know which day you got infected? Right. You yourself don't know it. So it's all an approximation.
Right. Let me turn this discussion more towards how the viewer is going to see this. And for those of you who don't understand why this is so important, is because, you know, a lot of people get themselves tested. They come negative and they're like, fine, oh, nothing happened, and they go around with their life. They're still carrying the virus. That is what is leading to this massive spread, really. But Dr. Ray, come in on the fact, what do patients who have all the symptoms but are constantly testing negative, what do they do? Because we are talking at a time when beds are full, hospitals are full. If you don't have an RT-PCR negative, no hospital is going to take you in. What do patients like that do?
Before I answer that, I'll just give you a context to tests, okay? All tests in medicine, none of them are 100% sure, okay? So it's not just COVID which does it. So we have to get a context that this is not this, unusual virus in the sense of that it does not get picked up. There's all tests in medicine, nothing is 100%. So in that context, there are a lot of tests which are, have.
But we're seeing more of that in the second wave, and that's why we're discussing this today.
I don't think so, but I don't think so. None of us think so. I think most people are seeing patients. But anyway, having said that, those who get a negative, if their clinical symptoms are such that they match the COVID symptoms and they have persistent symptoms, if the RT-PCR is negative, they talk to the doctor. If the doctor believes that it is most probably COVID, we treat it as COVID. That's what we are doing even in the ICU. Many a times we do get critically ill COVID patients who may not test positive. And when they don't test positive, we treat them as COVID. We repeat the test, and even sometimes, very rare, that is very, very rare, that two tests or 3 tests come positive in a critically ill COVID patient, if it happens, but still we treat them as COVID. And people who are getting the symptoms should talk to the doctors and be isolated, get the treatment as necessary based on symptoms. And this, as doctors, as clinicians, we have done for all diseases. We don't go just by tests. Tests only help us.
Well, I'm sure you do, Dr. Ray. I'm just trying to imagine what's happening in the hinterlands, what's happening in UP right now, where anyways the medical infrastructure is of a very poor quality. On top of that, burdening of cases is taking place, and this then becomes just another excuse really to not take in patients. I understand that you're doing it, but my concern is actually coming in from there. Let me bring in Dr. V. Ravi as well in the discussion now. Dr. Ravi, what in your opinion is going wrong with these testings at all? In fact, yesterday we discussed the difference between the 2 strains on FYI, on how the strains were behaving in 2020 versus now. And one of the doctors actually said that they've seen a surprise result where sometimes an antigen you come positive, but RT-PCR keeps saying negative.
Thank you, Sonal, for having me on the show. Let me tell that I echo all the opinions and I second all the opinions of the 3 experts who are on the panel, Dr. Mahajan, Ray and Velumani. I just want to add a couple of things. It depends on whether the kit is amplifying the spike protein or not.
Right.
Most mutations are in the spike protein. I would second what Dr. Velumani said. One should be using PCR kits where multiple genes are amplified so that your chances are picking up are high. And Dr. Mahajan said a very important point that the timing of sample collection during the course of illness, if it is negative once, you have to do it. 5th to 7th day is when the PCR positivity is highest, number one. Number two, both nasal and pharyngeal swabs together have to be collected from a patient, because the sensitivity for nasal swab is different from that of pharyngeal swab or the throat swab. So both, if you collect, your chances of detecting is high. And lastly, there are people who come late in the course of their infection on 8th or 9th day, and especially if they come with very severe lung involvement, Dr. Sumit Ray will second it, nasal throat swabs can be negative. At that time, the bronchoalveolar lavage fluid, that means they put a pipe anyway for intubation, the deep lung fluid is the one that will give positive. Apart from this, all the other factors like specimen proper collection, transport, storage,
all of that
and
is, all of this is at play.
of the technician who's testing, like Dr. Velumani mentioned, all these are factors that influence the positivity result in COVID test. Over.
All right, lots to take away from what all of you have said. Let me quickly slip into a break. When we come back, we'll address some viewer questions as well. Welcome back. We are discussing how to tackle with this situation which is emerging now, where the gold standard of testing, that is the RT-PCR tests, are not always showing you the right result in the first go itself. But before I dive into more questions, let me bring in Dr. Mahajan very quickly on the fact that how bad is the situation of testing in Delhi, for example, to start with. And if you could give us some numbers there. I've been getting desperate tweets and messages throughout the day saying in Lucknow tests are not available, in UP situation is really bad, in Delhi it's taking much longer. How bad is the situation?
See, Delhi is doing, as far as numbers go for RT-PCR, doing very, very well. As you know, we've been doing more than 100,000 tests a day, out of which more than 70% are RT-PCR. So in Delhi alone, we are doing about 70,000 RT-PCR tests every day. And by and large, we are trying to stick to the 24-hour deadline, which ICMR has actually mandated and which we are trying to follow. There may be exceptional cases where it may go above that deadline, but the labs are working and working overtime. Instead of 2 shifts, 3 shifts are being done. You have to realize that we cannot get more equipment very quickly. All the equipment is imported. At the very least, it takes 4 to 6 weeks to get it in. And hence, we have to use the existing infrastructure, people working harder, trying to get more technicians, more people to collect samples. One thing definitely that has gone down is home collection, because we don't have enough people to spare. But I tell you, Delhi has done a phenomenal job, both the public as well as the private sector. And if
there is some drive-through testing as well that is happening in Delhi, at least, which is a great option for people to explore. But again, I worry about, the other parts of the country. I worry about UP, Bihar, West Bengal and other places as well. Dr. Ray, can I bring in a viewer question for you, please? This is somebody who wrote to us asking about the vaccination process. If we can have that question on the screen, please. This is Mr. Bag asking, is there a shortage? If there is a shortage of vaccine, can 2 jabs of different vaccines be actually used? This is something, again, that we are seeing as a phenomena happening all over the country. What's your suggestion?
For now, there isn't evidence yet. This is being studied. Evidence yet that they can be used 2 different kinds of jabs. And it's not just 2 different kinds of jabs. Which 2 different types of vaccines could be used? These are being studied. But at this present moment, you cannot have different jabs at different time points. It has to be the same one for now. There is a possibility in the not so distant future that it would be possible to do 2 different kinds of vaccines, but that would be also specific which vaccine, the first one, and which vaccine would be the second one, or the other way around. But for now, it is not possible. It should not be done.
Okay. Can I quickly get in a word from Dr. Ravi as well at this point? I'm sorry, I'm running out of time. Doc, very quickly, for people who are extremely anxious, sitting at home, wondering what to do, what is your set advice to them on if they have symptoms? What is the protocol to be followed here? Not to just rush in for a test, not to just rush in for a hospital bed, but what is a sane advice that should be going out?
If they are contact of a known COVID patient, they should go for testing between the 5th and 10th, 7th day. Until then, remain on isolation. If they are symptomatic, they can go for testing as early as possible, because symptomatic patients, this sensitivity in symptomatic patients is quite high. So these are the two things. But I would say that till results come, please mask up, stay isolated, because results take, as you know, 24 to 48 hours, sometimes 72 hours. During that time, you can infect a large number of people. So giving a test and isolating is the most important advice I would give.
Dr. Velumani, last thoughts?
Yeah, never treat a test, treat the patient, treat the symptoms, treat the disease. So I think the statement told by our panelists that all tests will have false positive, false negative. Please follow the symptoms and treat the symptoms. However, if symptoms persist and if test is negative, please don't relax.
I think that's the best way to actually end this program. The wisest thing that you can hear today. Thank you all for your time. We understand you're completely burdened with so many cases coming up. So we really appreciate you and also bringing out the right information for people. Thanks so much for your time. That's it on FYI today. If you have any particular issue that you want us to raise on the program, do write into me. You can hashtag FYI and we'll be sure to pick that up on the program. Bye-bye for now.